Good morning or good afternoon, everyone. This is Melissa with you again. This is MPA 585, and I will be addressing market failures in the pharmaceutical industry. And to get started, what is a market failure? So, according to Stiglitz et al., a market failure occurs under specific conditions that are not Pareto efficient. Some of these conditions might include failure of competition, not being able to not having enough regulations to maintain a resource, uh, imperfect information, lack of innovation. For this specific scenario for the pharmaceutical industry, I will be focusing on two. The first one is the imperfect information. So, uh, like I mentioned earlier, the pharmaceutical industry has many conditions that contribute to a market failure. But in imperfect information, what happens here is that um, a party in a transaction knows more than another about a specific good. So in this case, a drug. This can be hidden or not fully disclosed in regards to the quality, safety, efficacy, value for money for a specific drug, or the appropriateness of a specific drug. This often leads to the most effective player being the patient. What happens as a result of the information imbalance between a prescriber can lead to misleading advice in order to increase profits. What has been observed to happen is that the prescriber will lean towards prescribing a specific medication. This lack of knowledge about a product can lead to irrational prescription patterns, resulting in increased profits. Aside from that, manufacturers may also manipulate this lack of information by providing distorting information so that the sales and product profitability are increased. Another factor is the failure of competition. So failure of competition has enabled the pharmaceutical industry to charge higher prices due to monopoly than they actually would in a situation where there was perfect competition. Some of the contributors involved are actually patent protections that are provided by the government. Also brand loyalty, in which the marketing is so strong that it contributes to the power it has even after the patents have expired. This also results in gaining control of that specific area or that specific brand so that it prevents other firms from competing effectively, for example, in the research and development. So due to these conditions, the government has become involved, and to address informational or lack of information, the government has responded by including or developing quality regulations or having practices for providing this information and training to both the consumer and prescribers in order to strengthen the professional ethics and prevent them from trying to prescribe for profit. It also requires licensing and registration for all those in the pharmaceutical sector to address the high prices. The government and create more competition. The government has created regulations by encouraging the use of generic substitution policies, where the drug will have the same effect as the brand name. This concludes my presentation. If you have any questions or comments, please post, and you all have a great day.